Hey everyone, Assalamualaikum, and a very good afternoon to all of you. Thank you again for joining us to another episode of Doctors Go Live. Okay, still nervous because Nina's not here. So anyway, I'm Sakinah Junaid, your host for today. I'm sitting in for our professional Nina, who's away right now, but she'll be back next week. And our Doctors Go Live episode today is in conjunction with Breastfeeding Week, which we had recently. We're going to be talking about relieving the pain of engorged breasts. Okay, I shouldn't be smiling, but I know how painful that is. Kan being a mom who has breastfed four, sekejap, 1, 2, 3, 4, betul. 1, 2, 3, 4 children. It's very, very painful, okay? And I'm sure mothers out there who have experienced this before, I'm sure you will agree with me. Okay, anyway, if you have any questions regarding the topic, feel free to type them in the comment box. And our guest today, yes, we have a special guest. Our guest today will be addressing them right after the show. Also, if you share this video out, you get to take part in our Doctors Go Live quiz, which is happening right after the Q&A segment. And you will get a chance to win a cooler bag. For mothers out there who are breastfeeding, cooler bag ni memang very useful kan? Now we know how it is. We have 3 of these cooler bags to give away. Thank you, Columbia Asia Hospital Setapak. For breastfeeding moms, all this is happening right now on Doctors Go Live with Miss Sakinah and our special guest today, Staff Midwife Jasvinder Kaur. Okay, but before our guest comes on screen, let's move on, ladies and gentlemen. It wouldn't be much to say that breastfeeding mothers know of the fact that the more you breastfeed, the more milk you produce. But what happens if you are in a situation where you are not able to express the milk? Or simply you are trying to wean your baby off breast milk, so you don't want the milk to come out. You know, it happens all the time. And of course, the result of this is engorged breasts, equal pain, a lot of pain. So today, our staff midwife, Jasvinder Kaur, who is from Columbia Asia Hospital Setapak, will be offering some tips and advice on how to relieve pain caused by engorged breasts. So all this and more happening right now on Doctors Go Live. So again, if you are breastfeeding or know someone who is, this is definitely an episode not to be missed. Do share this video out on your social media and tag your friends because this episode is definitely going to make a difference in their lives today. Banyak sangat cakap, so macam kena telan air sikit. So let's take a look at this video. Wow, dengan dia punya music pun suspend kan? Of course, it's a very serious subject among mothers with engorged breasts. Okay, so welcome back to Doctors Go Live. So for those of you who have just tuned in, we're going to be talking about breastfeeding, relieving the pain of engorged breasts. If you are breastfeeding your baby, congratulations, because that is the right decision. Okay, alhamdulillah. But if your breasts are producing more milk than needed, then this may cause you a lot of pain. So to help us, breastfeeding mummies, with this problem, we have got our expert from Columbia Asia Hospital Setapak, our very own lactation expert, staff midwife Jasvinder Kaur. Hi, Miss Jasvinder.
Hello, Puan Sakinah. How are
Thank you for joining us. Fine, thank you. And how are you? So berseri-seri.
I'm good today. So thank you so much for having me. I'm quite delightful today to share my experience and knowledge. One of the most common breastfeeding topic today we're going to discuss is about how to relieve the pain of breast engorge. This is very common and it's very important how to deal with mother.
Yes, that's right. Apparently, we've got quite a few people who are tuning in. So thank you so much. Wah, ramainya. There's Jasmine, C Stars, Jasmine, Tan Chu Sing, Nur Ida. Hi everybody, Chen Chen, Siu King. Wah, ramainya. And everyone else. Wow, Jasmine, so many comments. Thank you so much, guys, for engaging with us. All right, at the end of the show, before we start, at the end of the show, you absolutely want to enter our Doctors Go Live quiz, where we've got some cool looking and very practical cooler bags up for grabs. Okay, so don't forget about that. And if you have any questions, feel free to ask us in the chat comment box, and we will address them right at the end of the session. But before we start, let's get to know our guest better, Midwife Jasvinder. So, how long have you been with Columbia Asia?
Actually, I just joined. Before that, I was in different hospital attachment. So
Okay.
midwifery is not something new for me. I have experience for quite some time in midwifery, and
I
also
see.
in a support group of breastfeeding community where I
Mm,
educate
mm.
patients on how to breastfeed. The proper latching is very important here, and also
Yes, yes.
encourage mom in breastfeeding. Is no, we are like
Okay.
working mother. It's not easy to deal with such a
Yeah,
tough
that's
thing
right.
to do,
That's
as
right. You're
also
not just
involve a lot of
breastfeed.
emotions.
Mm.
So here to support the patients to how to
Okay.
deal with and overcome this whole process of motherhood.
Okay. So, what made you decide to become a nurse and specifically in midwifery?
Well, for
Get to know
me,
about you dulu, baru the topic.
of course, because I believe that nursing is something that it's all in my course, because I just love to take care of patients, and something
Mm.
which is unique about midwifery is dealing with the babies
I
and
see.
encouraging mom about the feedings and the labor
Mm. Correct.
process.
Yeah.
All those things is something which is really different, and you're dealing
Yeah.
with two lives is not like easy
Yes.
things to
Yes.
be. So I just
Yes.
love
Correct.
this is my occupations.
I see. I see. And where are you from originally?
I'm from KL, Setapak here.
Oh, I see. Well, that's very convenient.
Yeah, it's
From
convenient
your
to.
home to the workplace.
Yeah, I'm from
Pandai
KL.
you choose
I've got no
hospital.
hometown.
Okay, well, Setapak still home. Okay, so first things first, Jasmine, could you, okay, wait, let's start off here with the topic. So let's take a look dulu at the meaning of engorged breast. Apa itu engorged breast?
Okay. Important is to know first thing what is we are going to talk about all today is about breast engorgement, how it's actually developed and how you're gonna overcome this whole process of the things. Okay, what is engorgement here? I will define as occurrence of painful overfilling of the breast when the amount of the milk produced is more than the amount of milk removed from the breast. So meaning that your milk is producing more milk, but you are not being emptying the breast all the time. That's how you get the breast engorgements. So it's imbalance between milk production and milk demands. So your milk is producing more than baby demands, or you're not feeding according to the demands. The breast
Hmm.
engorge usually occurs on the third to fourth day of the postpartum. This is during yang masa pantang ni, kita akan
Yeah.
experience this. So this is the period where you will feel your milk is start to produce more. Usually day 1 to 3 you akan dapat colostrum. You will never get breast engorgement. Once
Right.
the breast start to fill up, you akan rasa dah apa nama dia, breast heavy, where your breast is milk is producing more milk.
Yeah.
So there where you will experience this heaviness, fullness. So you
Mm.
have to empty your breast. So the
Yes.
production of the breast actually change from colostrum to matured milk. Matured milk ni after
Mm.
colostrum now usually
Yeah.
day 3 above to 4 lah. Next slide.
So this is the anatomy of the breast.
Yes, I will focus on the other side. This is
Yeah.
actually inner part of your breast anatomy, how
Mm.
exactly
Mm.
it's look like.
All right.
I'll talk about more in detail in next slide. Okay, if you have a look on this anatomy of the breast, right? I
Mm-hmm.
just want to show this is our breast. Okay, example. So have you look on this cursor here. If I put alveoli, alveoli ni ialah milk production. Another way kita kata dia ialah proses untuk kilang buat susu lah. Okay,
Mm.
so dia akan produce the milk. Then
Yeah.
dia akan travel to milk duct. Yang kecil-kecil
Right.
yang ni, ini semua ialah kilang susu yang di storage. Dia buat dekat sini
Mm.
alveoli, dia buat susu. Lepas tu dia akan mengalir dekat kilang apa nama dia, storage, tempat kita
I
simpanan.
see.
Macam satu kilang bila dia buat macam barang apa nama dia akan produce the sesuatu produk, then dia ada
Yeah.
tempat untuk storage kan. Sama juga dengan kita punya breast. So ini ialah alveoli. Lepas tu yang bawah dekat yang duct area brown ni kita panggil areola. Just bawah dia saja is the duct of the
Mm.
milk duct. where dia
Yeah.
storage milk. So the
Yeah.
moment baby latch on, so that's why kita selalu suruh patients latch on at the areola side ataupun kita panggil
Yes.
dark area brown. So when
Mm-mm.
baby well attached dekat sini, baru susu tu keluar. Sometimes mothers dia attach the baby at the nipple. Dekat
Yeah.
nipple tu it's not the right place for the baby
Mm.
to latch on. So that's
Yeah.
why you get tendency of nipple soreness. So
Yes.
betul-betul dekat sini, dekat bawah tempat storage of the milk. Kita panggil milk duct lah. Di mana dia baby isap, susu tu akan keluar. That's the basically all the anatomy of the breast. Okay.
Okay. And rupanya there is a link between engorged breast dengan breastfeeding positions. So can you explain a little bit about this?
Yeah, sure. So the link is the position dengan attachments is very important.
Mm.
Sebab kalau you tak, contohnya dekat sini breast, baby hanya isap dekat yang dekat nipple ni, what happen actually, dia
Mm.
punya attachment tu tak bagus sebab dia tak
Yeah.
touch dia punya milk duct tu. Importantly, bila baby attach tu, dia punya ni dia kena betul-betul attach dekat areola side. So bila
Correct.
dia attach dekat areola side, actually you are helping the milk to secrete from the milk duct and through the
Mm.
nipple. Nipple tu hanya
Mm.
ialah satu perantaran untuk susu tu
Mm.
keluar.
Yeah.
Bukannya apa nama dia
Tempat susu tu.
tempat. Yes.
Yes.
So if your nipple too short or
Mm.
flat,
Mm.
inverted, doesn't
Mm.
matter. Because
Mm.
important is baby kena latch dekat areola side. That's the more
Yeah.
important thing. So bila you tak attach properly,
Mm.
this is
Mm.
how actually you dapat breast engorgement.
I
Sebab
see. Oh,
demand
okay.
is the production dah ada dah.
Mm.
Cuma the attachment dah wrong or baby
Mm.
demand is there but you're
Mm.
lacking poor attachment of the breastfeeding could
Yeah.
lead to breast engorgement.
I see. I see. Okay. I understand that ada some slides that will show positions of proper breastfeeding. Shall we take a look at that?
Yeah, sure. So this is the type of the breastfeeding positions. So we have few types of breastfeeding positions like cradle position, cross cradle position, football position, and lying down positions. So I just want to show cradles and football when exactly and you can do. So it's very important. Ini ialah cradle position. Usually I encourage the mother who are just after delivered, normal delivery, they have to hold this baby this side, important to see the alignment. So I always focus the alignment, the shoulder, the head and the shoulder is one straight alignment and the baby is facing your breast. It's
Mm.
not this way tilt. The whole
Yeah.
body should tilt towards your body, your breast.
Right. Yeah.
This is how you hold and you support your baby head and also the
Mm.
shoulder in one alignment straight. This
Mm-mm.
is
Yeah.
the right position. Ini kita panggil cradle position. Biasanya normal delivery mother, they are encouraged to hold the baby and breastfeed this way.
Macam ni lah. Okay.
And football
Right.
usually this way. Football kita panggil ataupun kita sandwichkan baby. Usually
Mm.
post section mother sebab dia ada luka kan. Dia
Yeah.
nak baby susah sikit. Nanti dia
Mm-mm.
definitely dia akan compress dekat wound area dia.
Yes.
Nak
Right.
prevent that, it's very
Mm-mm.
difficult for them to do cradle position. So football position is the best and I encourage them to do this. You hold your baby and still you need to support the head. You
Mm.
sandwich the baby in between your arm and this hand you hold the breast. And this is
I
how you
see.
attach the baby. Usually I advise mother to place pillow or
Mm.
something that they can support their elbow. So you don't need to
Yeah.
carry the baby. So
Mm.
with that attachment will be well supported and still you have to bring the breast near to the baby.
Right.
You have to bring the baby near to the breast, not breast to the baby. Some patients they like to pull their breast towards the baby. It's wrong.
Yeah.
So that's you are actually the attachment will go wrong. Another one
Mm.
is actually your nipple easily will get sore and
Yeah.
definitely your breast will be not empty. This is how you get the engorgement.
And I think your back will also become painful.
Yes, you need to lean back and comfortable. If you're on the
Yeah.
bed, you can lean back, you can prop up
Right.
the or you can apply something macam pillow ke support your back. That's more
Mm-mm.
because breastfeeding is something that you are going to breastfeed for hour for starting. It will be not for 1-2 minutes. So mother kena betul-betul confident and also
Comfortable,
kena
yeah.
comfortable. Sebab baby kalau some mother dia kekok, memang susah.
Mm.
Baby can feel,
Yes.
baby have the sense that mother
Oh,
is
I
actually
see.
not really comfortable holding. So they tend to get
Mm.
like crying, cranky. So
Yeah,
you have to be really comfortable holding your babies. Then you can actually breastfeed. Kalau
I
you punya
see.
position is wrong, so you tend to like stress. Then that's how you give up your breastfeeding.
Okay. Okay. Can we look at the other? There you go. Nak
Okay.
tanya.
These slides, we talk about the importance of the good positions and the attachment
Mm.
as I showed earlier, macam mana nak cara pegang baby kan. So this
Mm.
attachment is more to attachment. Macam mana once you dah pegang baby, the right alignment, as I say, you have to support the head, shoulder kan, in one alignment, you to bring the baby
Yes.
towards you. So, example, this is your breast, okay? So, what you have to do is you apa namanya, bring the baby near to you towards the breast. So, make sure the baby is latched on this dark area brown. Yang saya panggil areola tadi tu, dark
Mm.
area brown. Dia
Maybe we can
betul-betul.
focus on Jasvinder. Okay. Yeah, carry on.
Okay, so this is the breast of the mummy, right? Okay, so
Yeah.
example, this is the baby. So what we have to do is you have to bring the baby near to you. Make sure the baby open the mouth wider. Setengah tu
Mm.
macam force. So what you can do is you
Mm.
stimulate the baby mouth with the nipple because
Yes.
baby ni ada rangsangan tau.
Yeah.
Rangsangan itu akan actually membantu baby untuk buka mulut. So what you
Mm.
can take your nipple to, you just
Mm.
stimulate around this nipple, automatically
Oh, I see.
open them out wider. Yes, this is we call
Okay.
as a routing signal. Baby akan buka mulut according
Yeah.
mana dia punya stimulation. Kalau sini dia akan sini, depends.
Mm.
So once dia dah buka mulut, so you have to make sure baby well attached, betul-betul
Mm.
dekat sini area. Okay,
Mm.
not the nipple. So bila dia attach dekat sini, dia akan start suckle. And muka dia bukan cengkung tapi
Mm.
kembung. Kalau dia
Kembung.
cengkung masuk dalam,
Mm.
yes, dia akan ada bunyi suckling sound. If you heard the
Mm.
suckling sound, that means
Mm.
your attachment is strong. Your right
Mm.
attachment mustn't have sound or you mustn't
Yeah.
feel pain throughout your
Mm.
breastfeeding. Kalau you
Right.
rasa
Yeah.
sakit, I
Does that mean
advise
angin is coming in? I mean, when there is bunyi, macam will it
no.
result in
Yes,
calling? It sounds
maksud
like
dia
this.
yes, the meaning is actually kalau ada bunyi tu, that means the baby actually suckling at the nipple, not at the areola.
I
Sebab dia
see.
areola tu dia dah
That's
satu
wrong.
bahagian yang besar kan, automatically your pipi tu akan macam kembung.
Mm.
Kalau dia isap dekat nipple ni, you akan rasa macam dia masuk dalam, dia cengkung. Dia akan
Yeah.
automatically ada bunyi sebab some air goes in, you will feel the suckling sound kita biasa panggil. Kalau ada suckling sound tu, I advise the mother to relatch back,
Mm-hmm.
latch back. So how you can do, don't pull the nipple. Some they will pull the nipple or you're gonna saw the nipple. It's going to be very painful. Just put a
Mm.
little finger in it and you
Yeah.
akan rasa macam vacuum, So you just
Yes.
break the vacuum. That's how
Mm-hmm.
you dislodge, this how you remove the relatch back.
Yeah.
So when you pull, definitely you're gonna hurt your nipple. Do not pull.
Right. Yeah.
Baby kalau dia suck, dia macam vacuum tau. Very strong.
Mm.
Dia
Yes.
tak macam how to say, just normal suck macam tu.
Mm-mm. Mm-mm.
In those mother breastfeeding, they will
Yeah. It's,
understand. Yeah, macam they latch on to, you will feel quite painful, like
right. Yeah.
starting lah, discomfort. I will not say painful,
Mm.
discomfort lah basically.
Yeah. Yeah.
So it's very important to bear mind on the attachment. So as I say, facing the breast, nose, position the nipple, baby brought to breast, not breast to baby. This is very
Mm.
important. I want to talk about. Some they will bring the breast towards the baby. No, that's not right
Yeah.
way. You always have to lean back. Comfortable yourself is very important because if you don't comfortable, you don't feel that you can't breastfeed for long. You tend
Mm.
to you will breastfeed for the short term and baby will be not content. Baby tak
Yes.
content, breast you tak fully empty. That's how you tend to get the breast engorgement.
Engorged breast. I see. Yeah.
Yes. So it's very important. And then head and shoulder well supported in one alignment. As you
Yeah.
can see in the picture, you see the
Yeah.
alignment is very, it's a straight one alignment,
Mm-hmm. Mm-hmm.
well supported. So I advise mother to get some pillow or something to support their elbow. So you don't need to carry the baby. Instead of you support with something. So
Right.
next.
Nowadays they've got things like a special breastfeeding pillow, but actually you don't need anything that is specific, and you can also just have bantal
Actually,
biasa.
depends on the patient. Some patient they prefer that as long you're comfortable. I
Mm.
will say that as long mommy comfortable because
Mm.
you gonna breastfeed.
Yeah,
Definitely, you know better what are the
right.
position and the way that you want. If you're comfortable with that breastfeeding pillow, then you can
Mm.
go ahead with that. Or if you want to use just normal pillow or something a
Mm.
smaller pillow, as long you
Mm.
got something to support your elbow,
Yeah.
uh, then you can go for it. It's not to say necessary to get the pillow, but as long
Yeah.
you're comfortable during your breastfeeding time.
Yes, yes. Okay. As long as they are comfortable. Right. All right, got
Yes,
it. Now, sorry, should we take a look at the next slide, which is about the symptoms? Oh, okay. Yeah, we're still on the subject of
this is the
attachment.
attachment yang sama actually. I'm talking about really
Yeah.
yang apa nama dia, the more areola above the top of the lid yang as I
Lit.
said tadi yang
Mm.
saya cakap dia tak boleh cengkung, dia kena kembang.
Yeah.
So this is what I mean. So another one is mouth open wider, the lower
Okay.
lip to turn out. So bila dia attach betul-betul dekat areola sini, dia
Mm.
punya lower lip tu automatically akan turn out sebab dia
Mm.
dah cover
So,
majority of the area. I will not say all, but majority
yeah.
because the mouth is not that big to cover up the whole part. It's just
Yeah. So
majority
we should
part.
be able to see that lah, the lower lip of the
Yes.
baby.
And then the
Okay.
chin usually touching the breast. This is the
Right.
important, as you can see in the picture.
Mm-mm. Okay. Well, that baby looks very comfortable.
Yes. So definitely
Looks
this
like it's
baby.
dozing off already. Okay,
Yeah.
so let's take a look at the symptoms. How do you know whether there is a problem or not? Oh, not yet. Okay, it's still about latching on.
Same thing. The how to stimulate, as I already covered earlier. In a
Yes.
starting when you want to breastfeed your baby, right?
Mm.
Initial time, how you want
Yeah.
to initiate the feeding. So you have to touch the nipple. Actually, touching the nipple actually to stimulate. So baby that
Mm.
oh yes, that's a nipple is coming. Actually, we have
Yeah.
baby have the sense around the nipple here.
Yeah.
They have the sense, so they akan tahu oh it's that's a nipple and they
Mm-mm.
can open the mouth. But touching the
Mm-mm.
nipple will help to stimulate the mouth to
Yeah.
open
Yeah.
wider. So
Mm-mm.
sebab kalau dia buka mulut kecil, so
Yeah.
dia gonna unlatch on at the nipple. So
Mm.
tendency to get nipple sore, bleeding is higher. So you
Mm.
have to stimulate the baby mouth so the mouth will open wider. And
Yeah.
aiming covered all the areola side, majority, not all.
Right.
And
Yeah.
good attachment, as you can see, it covered all and baby will latch on. And penting
Mm.
tak ada bunyi and you don't feel pain. If you feel pain, that means your
Mm.
technique or your position is wrong. You have
That's
to
right.
relax back. Okay.
Okay. Okay. But there's also a stimulation that comes from the mother, right? I mean, when she thinks of a baby and then her milk will suddenly produce.
Yes, this is
Yeah.
the hormone oxytocin, or we call it as a bonding between babies and mothers, a love
Yeah.
hormone. Yeah, the
I
moment the
see.
mother start to think about the baby and she can feel them. This is actually the hormone that produced in the mother after delivery. We call it as
Mm.
oxytocin hormone, or we call it as
Mm-mm.
a love hormone. So that's
For the
the
baby lamb or
yes.
any love. Okay.
Hmm.
I see. Okay, so now we're going to go to symptoms. Yes, betul. Okay, signs and symptoms of breast engorgement is wrong. Okay, carry on.
Okay, the sign and symptoms. Okay, as you look at this picture, right, you can
Yeah.
see the breast size is increased bigger and it's like a flushed and the nipple pun nampak dia macam keluar kan. This is the
Mm-mm.
sign of breast engorgement. Okay,
Yeah.
it's pain, tender. Sometimes you get warmness, and
Yeah.
both breasts or one breast dia tak semestinya dua-dua, it could be one
Mm-mm.
side, depends on
Oh, I
which
see.
breast are empty. So it's not both breasts, sometimes
Right.
one breast or sometimes
Mm.
both breasts may be present. And the breast is engorged, feel tense, heavy. You akan rasa very heavy, macam batu, you rasa
Mm.
very
Mm.
heavy and discomfort. And you will have like thrombing pain, and acute pain on movement. That means when you want to move, you will feel pain. General body temperature pun akan rise. So advisable mother to wear bra lah. So at least they will get well supported. Otherwise, they will feel more heavy
Yeah.
and discomfort.
Okay. And we've got a few more symptoms, I think, some slides on the. What the symptoms?
This
Yeah.
is usually they will get temperatures, so they will tend to get fever. Is common because
Oh, I
of the
see.
rise. Yeah, dia akan dapat fever.
Hmm.
Once you dah rasa breast engorged,
Right.
usually low grade temperature lah, and nipple will be edematous and flush as you see in earlier picture lah. If the
Mm-hmm.
breast dia akan memang engorged, dia akan size dia akan increase bigger
Mm-mm.
from the normal size dia akan increase bigger. So always
Mm-mm.
like don't get self confused between filled breast and engorged breast. Filled breast tu milk start producing tapi dia
Yeah.
tak how to say
Tak
painful.
comfortable.
Just you
Ah,
feel
okay.
heavy. So that breast is after breastfeeding you can empty by pumping. Engorged dia you akan rasa macam ketul-ketul, you akan rasa macam
Mm.
keras, macam
Mm-mm.
macam batu you akan rasa
Ya,
very hard,
bengkak lah macam
firm.
very
I will say
tight
firm.
feeling eh. Mm.
Yes, firm. You akan rasa macam keras, macam very firm. And
Yeah.
that breast, if you want to latch on, baby also will be not. Baby doesn't want to latch on because it's too
Mm.
hard and firm. Dia dah block
Mm-mm.
dia punya duct dah. So you
Mm-mm.
have to massage and to relieve the pain. Then only you can breastfeed.
Yeah. Okay, so both mother and baby pun kena comfortable kan? They
Yeah,
affect each
exactly.
other, I suppose. Okay, now we're gonna take a look at symptoms still ataupun the causes. Yeah,
The
causes.
causes. So macam as you see in the picture, right? So
Mm.
this is not on engorged breast. Tengok dia
Mm.
macam nipis biasa saja. This is
Yeah,
usually breastfeeding yang teknik yang betul. They empty the
right.
breast in the right way. So if you never do so, so you can see at the second picture dia dah engorged. Dia increase in the size. It can happen 24 to 48 hours time if your attachment dengan you tak actually empty your breast accordingly. So
Yeah.
what is the causes here? As I said earlier, improper latching. So latching is very
Mhm.
important.
Yes.
Sebab if you're not, your latching techniques is wrong, you tak boleh nak empty your breast. Milk, kilang dah produce susu dah.
Mm-mm.
Demand pun ada, cuma
Yeah.
teknik salah, so dia tak boleh nak empty your breast fully. So bila dia tak
Correct.
boleh nak empty your breast,
Yes.
so dia keep on producing milk tapi nak keluar tak boleh. So dia akan salur-salur tu akan sumbat. Bila dah sumbat, dia tak tahu nak keluar mana, dia akan jadi macam edematous lah, bengkak.
Mm-mm. Mm-mm.
Itu
Yeah.
yang punca utama dia. Lagi satu, infrequent feeding. Katakanlah macam you feeding 1 jam, after that next 4 hours, 5 hours. Tak boleh macam tu.
Mm-mm.
Breastfeeding usually on demand. Dia cepat
Yeah.
digest. Rasanya dalam 2-3 jam baby dah demand untuk next feeding. So
Mm-hmm.
your demand should be according to the baby's need. And
Right.
use of the pacifier. Contohnya baby tengah nangis, instead of you giving breast milk, you
Mm-mm.
guna pacifier. Itu pun
Mm.
salah juga. So
Mm-mm.
you are not doing the right way. Or
Yeah.
overproduction of your milk. Yang ni macam
Yeah.
contohnya your baby demand is lesser than your production. Maybe
Yeah.
your milk start to produce more, tapi demand baby tak as your production of milk. Usually this kind of patient, I advise them to empty their breast after breastfeeding so that they
Okay.
keep their breast empty. Dia tak adalah macam accumulate. Each time when you dah feed, dia akan macam bagi signal, the hormone will give signal to produce
Mm.
more milk. So that's the reason, if you feel your breast is full, just empty
Mm.
your breast after breastfeeding. That's the best way to do. And if you
And
feel
when you
your
say empty your breast, you mean to make the milk come out, to express the milk out.
yes, it's very important because example, if your breast is actually dah full,
Mm.
tapi you dah breastfeeding, tapi still
Mm-mm.
you rasa full, then you better you empty your breast. Otherwise, your tendency untuk dapat breast engorgement is very high.
Yes. And you can also express your milk dekat dalam bottle lah, so you can keep them kan. Sayang
Yes,
pula.
yes,
Milk.
you can
Okay.
keep.
All right.
So the next one is, let's say, uh, the same slide.
The previous slide. Yeah. Okay.
Yes. So I wanted to focus on, if let's say you have pain breast can. So what you
Mm.
can do is warm compress. Is if it's painful, then I
Mm.
advise you to do cold compress first for 5-10 minutes, then followed by warm compress. To actually warm compress ni actually to help the milk to flow easily lah. So duct tu dia akan loosen up. So if you rasa sakit, advisable to first do cold compress first, then gentle massage. Gentle massage nanti I'll show you the right way how to massage your breast and
Alright.
how you want to prevent this breastfeeding on demand. That's the only way to prevent And as I say, if your breast is still rasa full, you
Mm.
empty, you express your milk, then in proper position and attachment, and
Mm.
use cold compress when it's pain and swelling to reduce the pain. Meaning that settle with your pain first, baru
Yeah.
you massage to loosen up the edematous.
Yang apa? Sorry, say
Uh,
again. The last part.
edematous yang bengkak-bengkak.
Oh,
Dia
I see. Okay, okay. Oh, the
bengkak. Yang
alright, alright.
engorge basically bengkak, payudara bengkak.
Okay, I see.
Okay, next. Okay, what you want to do when your breast is engorged is very
Mm.
important. Macam saya dah cover up yang previous slide. You need to breastfeed your baby, basically, and you should continue empty your breast after feeding also. At macam saya cakap tadi lah, you have to express your milk. Tak kisahlah manual expression ke ataupun you nak buat pump also can, as long whatever you are comfortable. Doesn't it's not really necessary to use pump. Kalau tak ada pump dekat rumah, an expression pun boleh. Later I will show you the right technique to
Yeah.
express breast. Okay?
But sorry, nurse, kalau kita nak express milk and the breast is engorged at the time, wouldn't that be painful?
Yes, as I said, your breast is painful, right? So you
Mm.
need to settle your painting. So what you have to do
Mm.
here is do cold compress 5 to 10 minutes.
Okay.
Important you have to wear bra sebab you punya breast tu akan macam very heavy, you know. It's like
Yeah, yeah, right.
something on your breast. You will
Mm.
feel
Yes.
full, tender, heavy, warm. So you
Mm-mm.
have to wear a bra so that
Mm.
breastfeeding bra advisable. So easily you can breastfeed your baby. And
Mm-mm.
cold compress you boleh guna kain,
Yeah.
letak dalam fridge, bagi dia sejuk. Bila dah sejuk, you apply on the both breast for 5
Mm.
to 10 minutes until you rasa lega lah. Bila dah
Mm.
rasa kurang sakit, then after that half an hour later you can do warm
Mm.
compress.
Use a
Uh,
kain, you were saying, just like put a
yes,
cloth in the freezer?
yes, yeah. You can just use a normal hand towel, put in the
Okay, alright.
freezer
Yeah.
better dia lepas sikit sejuk. So bila you
Mm.
letak dalam freezer dia dah
Or
sejuk.
a bag of the
Yes.
vegetables, macam.
Uh, Cabbage,
Peas,
no. I
bag
don't
of peas.
advise patient to use cabbage because yes, cabbage dia boleh surutkan bengkak. Tapi pada
Mm.
masa yang sama, dia akan stopkan production of milk. So it's not
Oh,
advisable. No,
I see.
I don't
Yeah,
advise.
this is also one of the tips yang kita dengar kan from our mothers lah
Yes,
dulu.
yes, olden
How
days.
we
Yes,
can use cabbage untuk treat bengkak susu. Also, it can actually decrease milk production.
yes, it will disturb your milk production. Dia akan
Okay.
decrease. Memang bengkak you akan surut. Yes, you apply cabbage, bengkak you
Mm,
akan
mm,
surut. Tapi at the
mm.
same time, it actually disturb your milk production. Dia akan
I
surutkan your
see.
milk production. So the right technique, pakai je
Mm,
towel, letak dekat
mm.
freezer, bagi dia
Yeah.
sejuk. Once
Okay.
towel tu dah sejuk, then apply
Mm-mm.
on your both breast lah for 5 to 10
Mm-mm.
minutes. Once you
Okay.
rasa dia coolness tu dah kurang dah,
Mm.
then you can just remove lah. But if you feel
Okay.
still pain, you can apply again, no harm.
Yeah. Mm.
Settle your breast first for half an hour, then you can
Mm.
try with warm compress. Warm compress ni tu aman suam lah. You ambil
Mm-mm.
towel, then
Mm.
you squeeze, you apply on the breast, then you gently massage your breast. Okay. The right way untuk massage, you use your palm,
Yes.
you for ni, so you akan rasa ketulan dekat
Mm-mm.
yang
Mm-mm.
dia engorgement, you akan
Yeah.
rasa macam ketulan-ketulan dekat breast you.
The
So you
breast.
use your palm, massage. You will feel pain, slight discomfort, but that's the right way. If you're doing superficial, you will feel nothing. You don't feel pain. That means you're
Mm-hmm.
doing the wrong way. You must feel a little bit pain because you are actually pressing the lump. You not dissolve the lump. In order to
Yes.
dissolve the lump, you have to press the lump. So you massage circular motion, the
Mm.
whole breast, you massage according to this technique, you massage betul-betul. So you ambil
Yeah.
towel yang panas, just letak on the breast. While you letak tu, you massage. Massage, this
Oh, I
circular motion,
see.
yes, the
One.
whole breast until your nipple. You massage. Bila dah massage, you akan rasa breast tu dah lembut sikit, baru you express. Because if hard, dia ketulan-ketulan yang dekat sini semua disumbat. Bila disumbat,
Okay.
you pump susu takkan keluar. Memang takkan keluar. You have to
Mm.
massage. Untuk massage, you kena buat tuaman panas. Bila you buat ruangan panas, pengaliran darah akan berlaku dekat breast ni dalam.
Yeah.
So, bila ada pengaliran darah, dia akan membantu untuk dissolve dia punya clot-clot yang ketulan-ketulan tu. Bila ketulan tu dah lembut, dah soft, nanti senang untuk you express your milk. Once you dah express your milk, you dah empty a bit, then easy to breastfeed. Baby pun easily can latch on. If too
Yeah.
full, baby will never latch on.
Right,
It's
right.
difficult.
Kalau okay, so you do that because you want to express milk. But let's say if you want to stop breastfeeding, do you s- do you have to just go through the suffering because you don't want to express milk? Because the more you express, the more milk you produce. But you don't want to produce any milk anymore. Sebab
For
nak
those
stop. Yeah, ada yang nak
yang
stop juga. So
tak
how
ada
do
breastfeed,
you get through this?
those who doesn't want to breastfeed, then they have to consult the doctor. There's a medication to given to the patient to stop the milk production. They don't need to do anything, tak payah express, tak payah buat apa-apa. Just consult your doctor for that,
Oh, I
and
see, I
doctor
see.
akan bagi ubat. Yes, there's a
I
medication.
see, I see. Okay, so there is such a thing that you can just do that very easily
Yes,
lah with medication
yes.
because I thought that we just have to tahan, and then
No,
wait
no, no,
until the milk production stops by itself because the baby's not feeding anymore. And like
no.
slowly if the baby's not feeding kan dia macam
Ah,
surut. That's
dekat.
right
Sebab dia
off.
punya hormone actually dah produced during your pregnancy. The milk is already
Yeah.
there. It's just you are not feeding
I
because you're
see.
pregnant.
Yeah,
After
yeah.
that, ini dia akan once you dah delivered, you dah
Mm-hmm.
start initial breastfeeding, you are stimulating the breast to produce more milk. The milk is already there. The hormone is already there.
Okay. Okay. All right, so let's take a look if there are any more relief tips, advice, how to treat
Yes.
engorgement.
As I
Ni yang
said,
you kata tu medication and ice pack.
yes, I expect if it's painful and
Mm,
followed by warm compress after that. It's must warm compress to relieve or to dissolve the clot. Without that, it's very difficult for you to express your breast. And
yeah.
medication here is a painkiller. Basically, you have to
Mm,
consult your doctor
mm-mm.
about the medications lah. Yang
Yeah,
you will feel relief because it's not fair for you to bear the pain.
yeah, yeah, of course. But to know which kind of medication that is safe for you while you are breastfeeding, so
Yes,
your
you need to
advice
consult
is
your doctor.
talk to your doctor. Okay. All right. So let's take a look now at I understand that there's actually an event that's going to be happening in Columbia Asia Hospital Setapak kan. Can you tell us
Yes.
about the breastfeeding event?
Okay, this is
What's it going to
breastfeeding
be?
talk on the 27th August 2022
Mm,
on Saturday, 12 p.m. to
mm.
3 p.m. For
Okay.
those who are keen to know more about the breastfeedings,
Mm.
please join us on this event to help
Okay.
you out more and get idea of breastfeeding, basically how it's gonna be for those
Mm.
already delivered or those haven't. Both
Mm-mm.
are welcome to this topic
Yeah.
and this workshop. So at least
Okay.
you will get to know more better about breastfeeding.
Okay. And also for those yang tak perasan, there's also a link that is in the comment section if you would like to register for this event, the beauty of breastfeeding. Okay. So you don't
Yes,
have to go anywhere else. It's just a lot easier for you to click on that link now and register. Great.
yes,
Okay. So this is the beauty of breastfeeding and how to relieve engorgement. That's fantastic. Thank you so much for your insights. Okay, now that we have a bit of information about that, and it's time for Q&A because apparently there is never a time when you know enough. There's
yes.
always more question to address. All right, but before that, we've got some prizes up for grabs also, which comes after the Q&A, okay? So I'll fill you in on that one in a while. Let's take some questions now. Okay, first of all, let's go to Jasmine Liu's question. What food is good for providing more milk in breastfeeding? Okay, doesn't really have much to do with breast engorgement, tapi tak apa since we're on the subject and we do have the time. So what do you say, Ms. Jasvinder? What kind of food is great
Okay,
for
for those
milk
mother keen
production?
for breastfeeding, usually I advise them to take more fiber because fiber will actually help to produce more milk. It can be oats, any
Oh,
fiber
I see.
food
I
that
see.
help in production. Yes, and also
Yeah.
you have to drink water because when you are breastfeeding, right, seventy
Yes.
percent of that actually the water
Mm.
is goes to baby because you
Right.
tend to get dehydrated. So you have to hydrate yourself It's very important. And
Mm-mm.
fiber food is encourageable to patients who want to breastfeed their babies. Actually,
Yeah.
it helps
Is
to
it true that you need to drink a lot of soya bean? Oh, that's a
no,
myth.
it's not really soya bean. It can actually any water as long you hydrate yourself. I think normal plain water will do. We need
Okay, so that's the
hydration.
best lah.
Yes.
Okay, so that is the best thing. Shimir is asking, my daughter is already 1 year, 5 months. Oh, can I still get bengkak susu? Let me see.
Usually at this time, not really, unless if you never breastfeed your baby or you never empty your breast. Yes, tendency to get back also it happened.
Okay. I've got another question here, also by Jasmine. She's asking about what is the benefit of breastfeeding for both mother and baby? I think that's a big content thing kan, because that's a lot. So
Yeah.
maybe very quickly, kalau you nak summarize a
Yes,
short
okay.
answer.
Okay. Breastfeeding is very important because for the baby, actually, it's give lot of nutrition. As we know, the breast milk contain of antibiotics, the nutrition, all that baby need for the baby growth and also
Yeah.
for the IQ level of the baby. Kalau you tengok dekat formula kan ada DHA semua, all
Yes,
those things
macam
actually contain in the formula, breastfeeding, the breast
supaya
milk. So you
susah-susah
don't need nak cari DHA ke apa.
ready. Yeah.
Dalam susu breastfeeding baby mother tu dah ada semua dah. Importance is to help your baby from having any infections. So all the antibiotic, the nutrition that your baby need for the growth, all those is contained in the breast milk. And for the mother, obviously it help to contract your uterus. Usually
Yes.
mother are quite worried about the contraction of the uterus kan.
Yeah.
Dia
Yeah.
macam nak buat bengkam lah, nak buat apa nama
Macam-macam.
dia. Yes,
Yeah.
macam-macam. So all those you don't need to do. Actually, you continue breastfeed your baby. Within 42 days, the uterus will contract back to the pre-pregnancy size. It helps to shrink faster. And also the important is prevent you from excessive bleeding. That's very important for the
I
mother. So
see.
when you breastfeed your baby, and lastly, mother always wanted to hear this. Actually, breastfeeding actually can space the pregnancy. If you
I
exclusively
see.
breastfeed, bukan campur exclusive. Exclusive
Mm.
here means that you breastfeeding your baby without any
Mm.
formula or any
Yeah.
supplement beside breast milk for 6 months, and then
Yes.
after 6 months with supplement of diet. Continue.
So that's a lot of benefits.
Yes,
Contraception pun dia, nutrition pun dia. Okay, well
yes,
that's great to know.
yeah,
Okay, I think we've addressed this question already by Ms. Jasmine Liu, how to use a cold compress to prevent engorgement. I think tadi Jasvinder you ada demonstrate kan? So
yes.
yeah, okay, so that's great. We've got some questions here by Miss Nurashkin Azami. Wow, she's got 3 questions. Okay, let's take a look. The first one, is it true that milk color depends on our diet? Wow, I guess she means like kalau you makan masak lemak, you punya milk color yellow ke, you makan sambal, milk color merah ke, masak kicap.
No, no,
So
it's
what do
not
you say to
really.
this?
It's not really on that, but sometimes like you have your food macam too much of like pepper or spice, right? Baby
Yeah.
tends to get macam loose watery stool, but the color,
Oh, okay.
it doesn't actually focus on the color but focus on
Yeah.
the things like example like you have taken too much of spices or too much of ginger in initial stage kan, they can actually help the jaundice level to increase also.
I
So but
see.
color no, as I said, you have to drink more water. If you less drinking water, maybe you punya consistency of the milk tu akan kurang lah. Sebab
Yeah.
you hydrated kan. So that's why I
Yeah.
focus on you have to hydrate yourself.
How about the flavor of the milk? Does it change
No,
depending
no,
on what the mother consumes?
no, no, it's
Does it?
not.
Okay,
No.
all right. Because I do hear that a lot also. People always say nanti kan pedas.
Pada as
Nanti
I
macam
said,
bau
mungkin pedas
durian
you
lah
makan.
macam-macam.
No, pedas kalau you makan mungkin dia stimulate the baby's stomach. You tend to
Yeah.
get those. Tapi tak ada kaitan dengan macam amount ataupun color of the milk.
I
Tak.
see.
Dia tetap warna putih. Dia takkan keluar kalau you makan apa nama dia macam something yang macam masak lemak ke ataupun masak merah ke dia warna tukar jadi
Pedas
warna
ke
merah.
kuning ke susu tu. Okay, all
Tak
right.
ada.
Okay, so next question is how to know that our breast is still full? How to
Okay.
know if your breast is still full? Okay.
Okay, as I said earlier, after breastfeeding, you still akan rasa macam heavy. You akan rasa heavy, automatically you akan rasa heavy, you akan rasa breast you still macam full lagi. So in that condition, after breastfeeding, I advise mother to empty your breast. So usually kalau your baby demand is every 2 to 3 hourly, so 2 to 3 hourly you empty your breast, you express your breast.
I think
So
with the
yang
experience, you can possibly tell when a breast is full or a breast is nearly empty. You can feel it
breast
yourself, maybe according to the weight, berat, ringan.
Okay, basically I will say that when is the breast is full, you akan rasa heavy.
Yeah.
Tu je, you akan rasa heavy. So once you
Okay.
dah empty the breast, you feel lighter. And how to express hand expression, I wanted to show earlier. So what you can do
Okay.
is, as I say ducks kat sini kan, you just hold
Yeah.
it and you just need
I
to,
think you need to bring up the
yeah.
thing a little bit. Yeah. Okay. All right. I can see it.
Okay, so yang ni, this is your breast, right? So what you have to use hand expression. Kalau yang palm tu senang je you letak kan.
Mm.
Yang hand
Mm.
expression, as you know, this is our duct dekat areolar side kan,
Yeah.
ataupun duct brown area. Hold your palm this way, letak dekat sini atas. You just need to squeeze this part. Jangan squeeze semua. You just
Mm.
squeeze here and release one shot. Squeeze and then release. Baru you akan rasa susu tu akan menitik. So you can use any cup or bottle to
Yeah.
just place underneath your nipple so that the
Mm.
moment you squeeze, your milk start to
Mm.
dripping. Setengah orang dia
Yeah.
akan squeeze macam ni, no, that's not the way. Ataupun dia squeeze dekat nipple, no. The milk will
Mm.
not flow from there. So the best technique is exactly dekat yang duct ni, yang milk duct yang tadi
Yeah.
saya
Yeah.
explain.
Mm.
Just put it your hand here, your
I
four
see.
fingers underneath your another
Right.
on your breast. Just hold
Okay.
it and you
Mm.
squeeze one round squeeze. That's it, and you
Can you
release.
squeeze it downwards? Is it just
Uh,
like that? I thought it's like that.
okay. No, you just hold it firmly, backward
Mm.
little bit, then you just squeeze one round. Tak payah pergi sampai ke bawah. This dekat
Okay.
sini.
Okay. I see.
You
That
don't
should
need
do
to
it.
move your fingers. You just
Right.
hold one time and you just squeeze. You don't need to squeeze until down. Just hold tight, firm, and
Yeah.
you squeeze. That's it.
Yeah.
You don't need to go until down. And you can see the milk start to dripping. Exactly betul-betul dekat yang start, area lah
Yeah.
side. That's it here. You don't need to go too down, not need to go too up. Betul-betul dekat
Mm.
sana. Sebab itu, that's the place of your milk storage or milk
Right.
duct.
Right.
That's the right
How
way
about
of.
Okay. How about those with inverted nipples? How does this work in terms of breastfeeding and
Okay,
engorged breasts?
as I said, inverted nipple, short nipple, flat nipple doesn't matter in breastfeeding.
Mm.
That's the right way of technique. Usually, we will tell the mother to
Yeah.
football position is the best for the inverted. Sebab easy to latch on. As I said, the football dia akan well
Mm.
attached. Ataupun if it's too difficult, certain cases we will
Mm.
use a artificial nipple, but usually very rare. Or we
Yeah.
can use the nipple puller to pull out the nipple. But
Oh,
usually
those are
football
new.
position I see successful.
Oh,
Most
ada
of
such a thing, nipple puller. Apa tadi? Artificial nipple. Wow.
artificial nipple
New.
is very difficult for the mother to pull out the nipple.
Mm.
Sometimes we
Yeah.
pull out at the time, then bila nak latch on, maybe susah nak grip. Then
Yeah.
that kind of condition we can introduce a nipple, artificial nipple. Dia
Right.
punya
Yeah.
exactly like nipple, it's in plastic, macam dia plastic. So just
Mm.
apply on the breast
Mm.
and you can attach the baby well lah. Dia macam
I
ada
see.
apa nama dia, macam nipple punya shape.
Yeah.
So
Yeah.
you
I
can
see.
easily latch on.
Okay. Okay, we've got a question here from Elsa May. I asked whether you use a breast pump or direct breastfeeding. Which one has more breast milk? Will breast milk come in more and last longer? Okay, so the difference between a breast pump and direct breastfeeding. Which one has more milk? Or
Okay,
which one can extract more milk?
obviously I will go for direct feeding because direct
Yes.
feeding, the one actually your body is giving signal to produce the milk. It's not the pump. Pump is only,
Ah,
as I said, after feeding. So kalau you tak direct feeding, your body is not giving the signal to produce enough of milk.
yeah.
So you have to breastfeed direct. Once you dah breastfeed, macam case yang one of the tanya macam mana nak tahu breast tu still full ke tak. Usually
Yeah.
akan rasa still full,
Mm.
heavy. Then after
Mm.
finish with the breastfeeding, then you empty your breast with express your milk from manual ataupun you can use the breast pump. But I always advise patient for direct breastfeeding. So
Yeah.
during after baby dah lahir, skin to skin,
Yeah. Mm-hmm.
once the delivered, you can start breastfeeding already.
Okay, all right. So we wish all the mothers who are here, if you've got problems with engorged breast and whatnot,
Yeah.
the advice and tips that has been given by Ms. Jasvinder tadi very, very useful. Okay, I'm just going to read just a few comments from some of the ladies here who are watching. I just Tan Q Singh saying that I just gave birth to my girl yesterday morning. Wow, congratulations. Want some tips for breastfeeding? Okay, I think Ms. Jasvinder has given a lot of tips just now. So that's great. And also Miss Jasmine saying, of course Miss Jasmine ni banyak comments. Great engagement. I felt flustered when I started breastfeeding my baby because my milk is so little and my baby is hungry. Okay, I hope what you've heard today will be able to encourage more milk production. Miss Jasvinder actually has shared with us quite a lot today. And then this is very, very true. Okay, so she says one more thing. Hubby support is so important for a for a breastfeeding mother. What do you think?
Yes, it is important because
Mm,
after you actually deliver, right, your
mm,
hormone is imbalanced. You will be like more emotionally down. You need someone to support you for feeding. Breastfeeding is
mm.
something that actually you require a lot of patience. It's not like you direct put on the breast, first suckle the milk will secrete out. No, you
Yeah.
need a lot of patience. As I said, it will take up to 1 hour to breastfeed. So if your husband can help, can support you, especially I always advise the patient, I mean patient spouse, to massage
Mm,
their back to
mm.
release the stress. That will
Yeah.
be one of the greatest way to support your wife in breastfeeding. And also,
Yeah.
it's very important to be with your wife, and
Mm,
when especially baby is crying, cranking,
mm.
understand the cues is very important, the hunger cue.
Yeah. Yeah. It's part of a very loving experience.
Yes.
Okay, so with that said, it's now quiz time. And as mentioned, the earlier part of the show, there are cooler bags here up for grabs. And if you want one, what do you need to do? First, you gotta be sure to share this video out at least 3 times and remember to set the share post to public so that everybody can see. Next, answer the 3 questions that will be showing on screen in a while in one single comment. Okay, so if it's 1, 2, 3, do one and then enter two and then enter. 1, 2, 3, semua dah you have collected your answers and then you press enter once. All right, let me repeat that. First, share this video out 3 times. Remember to set the post to public so everybody can see. Secondly, answer the 3 questions we will show on the screen in a single comment and we'll select the first 3 winners based on speed. Siapa cepat dia dapat the correct answers and share the post. Okay, so are you ready? I'm going to read the question now. Okay, one of the causes of engorged breast is due to the baby not latching on properly. True or false? I repeat, one of the causes of engorged breast is due to the baby not latching on properly. True or false? That's number one. Okay, number two, if your breasts are often engorged, you may be at risk of a breast tumor. Very serious. Okay, see if that's true or false. Again, if your breasts are often engorged, you may be at risk of breast tumors. True or false? And our last question, statement rather, you should continue to breastfeed even though you have cracked nipples. Okay, you should continue to breastfeed even though you have cracked nipples. So what do you say to that? True or false? All right, so while waiting to hear who the winners are, let's have a short chit chat dengan Miss Jasvinder. So yes, I've got some questions also. When you have engorged breast, usually the patients that you have seen, I think it can be very, very painful to the point of tears coming out, kan?
Yeah.
Usually they will, you've got this pain punya, what do you call it? Yang ada number 1, 2, 3, 4, 5 until 10.
Or
It's
pain
a
score.
rating. What do you call
Pain
it?
score. Pain score.
Pain score, yes, pain
Yeah.
score.
Pain
So
score.
from the many, many patients that you have seen, what is their pain score when it comes to engorged breast? Maybe there are some husbands out here who are also tuning in and maybe they have no idea. They just dengar wife berbual. But they don't know how sakit is the sakit lah.
Yes.
What do they
It's
usually
only,
say?
only women know, or those who deliver, they know the experience of how painful is the breast engorgement.
I see. Okay. All right. Wow. Suddenly I'm looking at the comment section. So many people taking part. Thank you so much, guys. Wow. Fantastic. Really, really nice. Okay. But just hang on there for a while until we get the results. So don't go anywhere. In the meantime, Jasvinder, do you have anything else that you would like to add? Maybe something that you have not yet covered
Uh,
about breastfeeding. It doesn't have to be about breast engorgement. It can be anything on breastfeeding.
Basically, I will just want to say breastfeeding is very unique. I encourage mother to breastfeed
Mm, mm,
immediately after delivery, according to your comfort zone. Now, if you think you're tired,
yes.
it's okay. But if you're okay,
Mm-mm,
usually normal delivery, skin to skin, then that's the time actually you can start with the breastfeeding, the
mm-mm,
latching, especially the bonding between babies and mothers. That's the time actually you can attach, and dia akan
mm.
start stimulate. Baby pun akan rasa macam, oh, this is my mom. Dia akan macam recognize
Yeah.
the breast, and you can start with the feeding. And breastfeeding is not something stressful. It's actually
Mm,
something that you can enjoy during
mm,
your
mm.
motherhood. You
Yeah.
just need your proper attachment and position. Trust me, you can breastfeed up to like 2 years if you are comfortable and you're
I
okay with
see.
that.
Yes.
Even a working mother can do so. It's not something
Mhm.
difficult. It's just you need the right technique and the right group and support group.
Do you know of any mothers who actually breastfeed even after the child is maybe 2.5
Yes.
years, 3 years, 4 years? Ada ke?
Yes, my colleague, one of them, even though they are nurses, heavy schedules, hectic thing, but still they breastfeed. And some of the
Wow.
patients, but some of the
Yeah.
patients, when I asked them, they was like, they're still
Mm-mm.
breastfeeding, even like, 2 years, 3 years.
Mm,
It's all
mm,
actually depends on your determinations and how you
mm.
want to schedule. That's very
I see,
important.
I see. So there is no harm even if you want to breastfeed your child for longer than 2 years old.
Yes, it's not
Okay.
harm. It all depends on you.
Okay. Wow. So the results have come in and I have got the names of the winners now. Okay, but before I announce the names of the winners, I would like for Miss Jasvinder to do the honors of telling us the answers to the
Okay,
statements earlier. Okay.
so the
One of
number
the
one.
causes of engorged breast is due to the baby not latching on properly. Is that true or false?
Okay, one of the cause for the engorged breast is due to babies not latching. As I already discussed earlier,
Yeah.
the real reason is the latching technique and
Yeah. So
position.
is it true or false?
It is true.
It's true. Okay. Next one. If your breasts are often engorged, you may be at risk of breast tumors. Is that true or false?
No, false. There's no
False.
connection
Okay.
between the
All
engorgement.
right. And the last one, you should continue to breastfeed even though you have cracked nipples. Wow. Definitely what?
No.
False.
For me, it's cracked nipple is not the reason for you to continue. You have to rest your breast. It's
Mm, mm,
so
mm.
painful. You tend to bleed.
Yes.
Definitely, you need to rest your breast, but you can express the milk. That's my suggestion. You can do hand expression or palm
Yeah.
expression, and then you rest your breast until you recovered. Then you
Yep.
breastfeed the baby. You don't need to really force into your breastfeeding until you put
Yeah.
yourself really
That's right.
torturing
Yeah.
yourself.
Yeah, lah, of course. We do what we can we do our best.
Exactly.
Okay, so with that, I shall announce the names of the winners. First, second, third. Mary Hannah Joshebed and MCC Ching and Yu Kyong. I don't know Miss ke Puan ke apa ke, but yeah, these three names have won. So congratulations to all of you. You will all be receiving each a cooler bag, which you can use to store your breast milk or your canned drinks or your fruit juices and whatnot. So, all right, don't worry about you don't have to go to Setapak, of course, but thank you to Setapak for sponsoring the quiz prizes today. Wait, now hold on. We will be contacting you after this within a day to get your details. So be sure to check your Facebook Messenger inbox. Okay. And with that, it's time to say goodbye to Miss Jasvinder for her sharings today. Really appreciate it. Thank you so much, Miss Jasvinder. We've all definitely have learned a lot from you today.
Thank you, Shakina. Take care.
And On that note, we also have to say goodbye to each other for today. We hope you learned a thing or two regarding the topic of breastfeeding. I do hope that there were also some guys out there, because it's good.
Yeah,
Uh,
hoping at least
yeah,
they know the benefit
yes,
of breastfeeding and
yes,
also,
exactly. It's a husband and wife thing. Fantastic.
yes,
And if you
exactly.
know And if, of course, if you know someone who will really appreciate these tips, info, and insights from today's show, please share this video out, tag them, because you never know who it's going to make a difference to. So give us a like and lots of love while you're at it. So thank you again. Take care, everyone. See you in the next episode. Bye.
Thank you so much.